Niagara County health officials are sounding the alarm upon seeing an influx of sickness and a decrease in vaccines.
And while people living in Niagara County are free to make their own health decisions, the county's health department says not enough people are making the right decisions when it comes to vaccines. Joining us now to talk more about this is the county's public health director, Dan Stapleton. Dan, thank you so much for joining us this afternoon.
Dave, nice to see you again.
Great to see you. Let's talk a little bit about some of the numbers that were released by the health department today. You guys are always so great with providing that information. And these numbers are alarming, and they are alarmingly low. Tell us why.
Well, I think everybody had the experience of having dealt with COVID for, 3 or 4 years, that there's a certain amount of people get tired of that. They get, they hear the same information over and over. And I think our residents in Niagara County responded very well during the COVID pandemic. Very proud of what the efforts everybody took. But now the state of emergency is over. People are starting to get a little more complacent about getting their vaccinations. Like I said, I understand that they're tired, but COVID's still here. Flu is still here. And of course, RSV is here too, and at rates that we've seen in the past. So all of those things combining are telling us people are a little bit complacent. They're not taking it as serious as they used to, but we need to continue to make sure people are aware that we need to get back where we were when we were in the middle of the pandemic in terms of vaccination rates.
So those are the vaccination rates. What levels are you seeing in terms of the numbers of people that have serious cases of COVID, the flu, RSV?
Well, when we look at COVID, for example, the amount of visits to the emergency department for COVID-related symptoms are about 3 times what they were last year. That's a significant increase in the amount of emergency department visits. Right now, we're seeing flu is still very high in the county, but we're starting to see a little bit of a plateau. Typically, the flu season peaks right around this time each year. Last year, if you recall, we had a significant rate at this time of year. We're definitely better this year in terms of the flu than we were last year. But, COVID continues to be a concern of ours. Like I said, when we're seeing, maybe 3 times the admissions and at least visits to the emergency department at hospitals because of COVID, that's important. RSV, we know that last year and the year before, RSV was very high. Our local hospitals across Western New York, we're seeing numbers that were very high, very concerning to us in terms of the amount of capacity of the hospitals have for additional patients. Right now, we're looking at about 14%. During the height of COVID, we're looking at capacity of maybe 3% available in the county. So when we look at things like that, of course, that's very important. And those are really good numbers. But our vaccination rates aren't where we want them to be, both for flu and for COVID. Flu is a much higher vaccination rate than COVID, but it's still not at the level we want it to be. We're starting to get more people vaccinated for RSV. Right now, the adult vaccination is available, but not the child vaccination yet for RSV. So, those are the big 3 we want people to be aware of: the RSV, the COVID, and the flu. Flu is, it's been around forever. Last year was a really bad year. But now we're seeing a better year. But right now, all 3 of those are high. RSV is just starting to go down. The peak of RSV season is usually in December. The flu season peaks right around now. So we're and COVID really doesn't have a season. I mean, yes, the rates are higher during the cold because people are together, but it's not like it is for flu or RSV.
Right. Dan, I'm glad you mentioned before how well Niagara County residents did during the pandemic for getting vaccinated from COVID. I'm wondering how much of this you think is the sort of the response from that mandate, from the state, from the federal government. So many people after that, and as the pandemic was waning, said, we will never, ever take a mandated vaccine again. People were really staunchly standing against those, saying there wasn't enough science. You've heard all the conspiracies, of course. We've heard all the conspiracies. How much do you think that is playing a role now? Because people are saying, hey, we've already done the you should get your vaccine, and we don't want to do it, and so we're not doing it. And now Niagara Health facilities are paying the price, right?
Yes, you're exactly right. when people talk about the everything we went through for the pandemic, and like I said, people were really great about it. But after a while, people have a limit. You know, we just like you said in your opening, people have the freedom to make decisions about whether they're vaccinated, whether their family gets vaccinated. When we're talking about the ability to spread diseases in school, at work, at large group where people get together, we see increases in these three during the holiday season when people get back. We see the numbers increase for school absences in school because of people being sick as the new year starts. So, I get it that people are tired of it. The flu has been around forever, and when you have 36,000 people die across the United States every year from flu, that's a big number. Mm-hmm. That's a concerning number. I think when people see that, that's something that people should be very aware of. I think that we'll see this continue to be an issue. Right now, this is the peak of our big three, if you will, and right now, the rates are high, but like I said, they're stabilizing or they're declining. Last week was a very high week for the flu and COVID. It's going down a little bit from what I'll see. I'll have my weekly meeting with the New York State Department of Health on Wednesday mornings to talk about those rates. So we're dealing with that now, and right now their rates are going down a little bit, but last week they were really high. And when I talk about that stat of across Western New York, the visits to the emergency departments being 3 times they were this same time last year, that should give people a pause and say, well, we really need to take this seriously. Like I said, we couldn't be prouder of what everyone did here in Niagara County, and we need to do that again now because the numbers are higher than we want them to be.
And Dan, very quickly, we are out of time, but before you go, there are a number of vaccination clinics coming up. Just run through those very, very quickly for us. Well,
we keep all those on our website. We did three clinics last week. We'll continue to do those. Those are all on our website. Those are ones are visited. We go across Niagara County, everywhere you can think of, we visit. When you're looking at Lockport, looking at the North Town of Bonnie, you're looking at Town of Porter. You look at Niagara Falls, we visit a lot. LaSalle. Those numbers, we're continuing to do this because that's why we want to make it as simple and easy as possible for people. We need to be where people are rather than always expecting them to come to where we are.
Great.
So that's why we're going throughout Niagara County.
All right. Dan Stapleton, the Public Health Director for Niagara County, thank you so much for joining us this afternoon. We appreciate it. This is obviously a very serious issue, Dan, and we intend to stay on top of it for you.
Great seeing you both.
Thanks, Dan.
You as well.